Today, I'm going to talk about 7 ways to help your health if you've been diagnosed with kidney damage. And the number one way is to cut down salt. But before we can talk about that, we really need to be able to understand what your kidneys do and why they're so important for your health. Are you ready? Let's go ahead and dive in. So, first of all, kidneys. You got two of them. And these kidneys are the filters for your body. Specifically, they filter your blood. Where are your kidneys located? Well, they're located in your back, all right, on both sides of your spine, just underneath the rib cage. If you reach back and you feel the bottom of your rib cage, actually reach in the front and move your hands all the way back, and you'll see where they meet, your fingers will meet in the back. Your kidneys are just underneath there, all right? One's on the left side, your left kidney, and one is on the right side. That's your right kidney. And as a filter, this is how the kidneys work. All of your blood runs through these kidneys, all right? And one of the things that the kidney does as it's filtering the fluid is that it makes sure that your body has the right amount of electrolytes. What are electrolytes? Well, they're chemicals that are naturally found in your blood. Chemicals that your doctor actually tests when you get your blood drawn on a medical visit: sodium, potassium, chloride, minerals like calcium, phosphorus, and magnesium. Now, you might not think about these minerals and electrolytes, these chemicals, very often, but in fact, they are critical for your body to be able to function normally. Your cells require these elements in order to be able to actually do their thing, to be able to maintain function, to keep you alive. Now, you're going to hear me talk about electrolytes again a little bit later in this video, but your kidneys actually are the filter to make sure that you have the right number of electrolytes in your bloodstream at all times, okay? The other thing that your kidney, the filter, does is that it actually makes sure that you've got protein in the blood, all right? Now, you probably know that protein is really important to eat when you age because our body, our muscles are actually made out of protein, right? And we need to actually eat protein. That's why it's a macro that's important in our nutrition. When we eat the protein, protein is made out of amino acids. Our body will take amino acids that we eat to build the protein in our body, all right? And we need that in order to be able to build muscle strength and all those other really, really critical aspects that proteins actually do. The other thing that proteins do in your blood is it keeps the blood in your blood vessels, all right? It's called oncotic pressure. So basically, when you got a concentrate of protein in your blood, it draws fluid into your bloodstream. And if you're low in protein, guess what? It doesn't have as much draw. And so the fluid in your blood vessels run out of your blood vessels into your tissues. And that's not good. You ever see somebody with really, really bad lower leg swelling, like the ankles, the cankles, they used to call it? You can push on the flesh and you can put a big dimple in there. Well, that can be due to a lot of things. Heart failure is one of them. But the other thing is actually when you actually have a kidney problem and you're not keeping enough protein in your bloodstream, and now fluid leaks out of the blood vessels because it doesn't have enough solute to draw fluid in. And then the fluid in your tissues, gravity, right? So your ankles actually swell up. And that's another kind of sign that you don't have enough protein in your blood. That can happen if your kidney, which keeps the protein in your blood, so it's a filter. It lets out the urine or the liquid for urine, but it keeps in, and it lets out some of the electrolytes, the sodium, the potassium, the magnesium, phosphorus. Make sure that the right amount is in the blood, and the protein, it hangs onto the protein. It's not supposed to let the protein go, all right? If you let protein go into your urine, then your urine will become frothy like protein, all right? So the kidney actually holds on to that, and so that your blood continues to hold on to protein. Very important function of the filter. Now, how does your body do this filtering process, all right? Well, your kidney is actually made up of thousands of tiny little blood vessels that each of them end up in a filter. And the filter is like a little ball. There's a name for them. We call it the glomerulus. or many different glomeruli in the kidney actually make the kidney one giant filter. Each glomerulus is at the end of a blood vessel. All right. So think about it like a skewer with a ball on the end of it. The skewer is the main blood vessel. The end of the skewer, the meatball, is filled with blood vessels. That special blood vessel actually does the filtering because the liquid goes in there and that the filter is right inside that glomerulus. All right. Now these balls, the filter, have special cells that do that filtering function. You know how many balls, the filters that each kidney has? Each kidney has 500,000 of these little ball filters, the glomeruli. All right. And so your left kidney has 500,000, your right kidney has 500,000 filters. So collectively, together, our kidneys have 1 million. Our body has 1 million of these filters, half of them in the left kidney, half of them in the right kidney. All right. Now, every bit of blood that enters the ball filter, all right, about 20% of it goes out of the filter, turns into urine. And that means that 80% of it, of the liquid actually is, which includes the blood cells, are kept back inside the filter and returned to the body. Let me say that again. All the blood in your body runs into these filters, these million filters that are in the left kidney and the right kidney, 500,000 on each side. And when the blood goes through, about 20% of it is filtered out, mostly as liquid, and it turns into urine. That's how urine is made, all right, that trickles into your bladder. But 80% of it is held back, and including all the blood cells that you want to keep and the protein, all right? That 20% that becomes urine drains into your bladder, and as it continues to collect, your bladder fills up with urine. When your bladder stretches, you feel like you need to pee, you need to go to the bathroom, and then at some point, when you find the bathroom, you let it go and you drain it. But your kidney 24/7 is actually doing this drainage function. It's a filter, all right? Now, you can imagine, based on what he just told you, how important your kidneys are for normal, healthy function. Regulates blood volume, regulates the protein in your blood, and makes sure that the electrolytes, the natural chemicals that are found floating in your bloodstream to keep cells working, is always at the right level. So, if your kidneys are damaged, your health is going to get damaged. And let me just talk about now how that happens. All right, how does your kidney get damaged? There's a lot of different ways that your kidneys can actually suffer damage. One of them, and the most common way that kidneys are damaged, is high blood pressure. Now, you probably heard about high blood pressure causing cardiovascular disease, right? Hypertension leads to stroke, can lead to heart failure, right? Hardening of the arteries. But guess what? Your kidney is made out of blood vessels. And so high blood pressure also damages the blood vessels that are actually serving as your filters, all right? Damages the filtering system. The second most common reason that the kidney can be damaged is type 2 diabetes, all right? Type 2 diabetes is the second most common cause of kidney failure. And of course, diabetes damages the blood vessels as well. Now, I study angiogenesis. That's the study of blood vessels, so I know a lot about this. Type 2 diabetes, you actually damage the lining of blood vessels, the endothelial cells, and this also happens in the kidney. So you wind up having diabetes damaging the filtering system as well. Kidneys can also be damaged by medications. There are some medicines that are nephrotoxic. That's a fancy word that means toxic to the kidneys, the nephrons. That's a big unit of which the glomerulus, the filter, is part of it. Infection can actually damage the kidney. I remember when I was a kid, the neighbor of one of my best friends had a strep infection and stopped taking his antibiotics as soon as he felt better, but didn't take the full course of antibiotics. Well, his throat infection, the strep, went down into his kidneys and damaged his kidneys. And I remember it's one of the first times I heard about somebody a kid getting so seriously sick, he ultimately actually died of kidney failure. This is way back when. All right, we could probably save somebody with that situation now. But infections, when your kidneys are infected, that can also be a cause of kidney failure. Here's another cause of kidney failure: is blood clots. You know, blood clots can be sent out of your heart. If you have atrial fibrillation, you can actually send a clot to your brain. So what happens is that the heart normally pumps When it fibrillates, basically it's kind of wiggling. The blood doesn't flow as smoothly. There's little eddy currents that get trapped. Blood can clot there, and then boom, you have one pump, and you can shower clot. And when that clot gets showered into your brain, it's called a stroke. But you can also have a stroke of the kidney, and that's when a blood clot leaves the heart. Instead of going up to your brain, it goes down your aorta, the big blood vessel, and it gets showered into kind of like dirt. If it's thrown at you, it gets showered into your kidney. And guess what? Because the blood is filtered in the kidney, those clots get caught into the glomeruli. Now you've actually caused another form of kidney damage. All right. So when any of these types of things happen, you can make less urine, for example, and that can lead you to accumulate fluid in your body. Your electrolytes, the sodium, potassium, phosphorus, magnesium, calcium, all those electrolytes can go out of whack. And now your cells can actually start to malfunction. They don't actually work properly. Too much potassium or phosphorus, for example, actually can be dangerous to your heart and dangerous to your brain and also your other organs as well, right? So you really need to be able to have those electrolytes managed really carefully. You don't want to damage that filtering function. And if your blood pressure is already high and you want to kind of keep it low, if you damage your kidney, it turns out that there are hormones made by the kidney to also help to manage blood pressure. I don't have time to go into all those kidney hormones today, but keep in mind that your kidney makes hormones that actually help to regulate your blood pressure. So when you damage your kidney, those hormones can kind of be derailed, and now your blood pressure can go sky high, not only because of the excessive fluids, not only because of the electrolytes, but even by the hormones that are made by the kidneys can go out of whack, and now your blood pressure can really soar. All right. Now, what do you think is going to happen if your blood pressure goes even higher because of kidney damage? Well, that sets you up to actually have more dangerous hypertension, high blood pressure, which is more dangerous for your heart and more dangerous to your brain. All right. So think about your kidney as a continuum of your cardiovascular system, because the filters, the little balls at the end of the stick, the glomeruli, those filters are also part of your circulation. All right. There's specialized blood vessels that do the filtering. So damage in one area can cause damage to the other. This is how all the body is connected. All right. So how do you know when you have kidney damage? That's pretty important to know, right? Well, the answer is you probably are not going to know in the beginning when you have kidney damage. Kidney damage is often silent. All right. It just occurs quick and silently. Like if you have an infection, you won't even know it when the bacteria go into your kidneys and start causing a problem. If you take a medication that knocks out your kidneys, you won't even know it until you actually have a problem. But then you'll start seeing changes in color of your urine. You might have pain in your kidneys. So it can actually be very silent until you actually have a problem. Now, that's acute kidney failure that can happen quickly. But kidney failure can also build up over years, like diabetes, right? Diabetes kind of slowly sneaks up on you. You've got problems with your metabolism. You've got problems with insulin sensitivity. Your blood sugars start to creep up. This high blood sugar and poor metabolism wears down and causes damages of the lining of your blood vessels everywhere. Now it eventually affects your kidneys. This is not a process that happens overnight. That process with diabetes actually happens over years. And your kidney can compensate. Actually, there's got a lot of nephrons. You got 1 million nephrons. So you can knock out a few of them, and the rest of the kidneys will actually compensate. But eventually, when you knock out enough of those nephrons or glomeruli, the filters, when enough of those filters get knocked off, you know what? You'll start noticing changes, usually in your urine. Hey there, check this out. I've got a guide for you. It's about 3 foods to fight diabetes, and it's free. In the guide, I share simple, easy-to-use ingredients that you can add to your meals starting today. These are the foods that I eat myself, and they're packed with healthy bioactives that support your metabolism and help prevent insulin resistance. My guide is yours right now, free in the caption below. All you've got to do is click the link below the video. Now, let's get back to the other video. All right. The urine, which actually should be clear or maybe light yellow, right? That's what we're used to when we're feeling good and healthy. Your urine starts to turn dark. Okay. It could even be dark brown. And if you take a pee and you look in the water and it's like a color that's kind of freaky to you, like dark brown, it might even have blood in it, it might even have blood clots in it. That's usually what brings you to the doctor, and who's going to basically say, wait a minute, let's take a look at this. You have a problem in your urinary tract, and your kidneys are part of the urinary system. And so your doctor's going to order some blood tests and maybe a urine test to check on the health of your kidney. All right. And if there's a problem with a blood test, your doctor might order additional tests that could involve collecting urine or maybe getting a scan like an ultrasound or even an MRI. All right. You can even do a dye study where they inject dye into your vein in order to be able to study the circulation. Because don't forget, all the blood gets filtered into the kidneys. So when you inject a dye, you can actually see where the filter might actually be having a problem. Okay. And then after all that, then your doctor will actually decide on next steps. So what I'm trying to say is that kidney problems can sneak up on you. By the time you notice them, it's pretty alarming because of the change in color in your urine. You go to the doctor is going to order blood tests, maybe a urine test, maybe a scan. And based on those results, we'll actually make a decision on what to do. So I'm sharing with you sort of like the mind of how a doctor actually thinks. Now, and when it comes time to come up with a diagnosis and then deal with whatever the problem is, your doctor is going to be working closely not only with you, but with a nephrologist, which is a kidney specialist, all right? Because kidney failure really is not a family doctor, primary care doctor issue. It's something that really should be you need the help of a nephrologist, a kidney specialist to help really, really figure out how to guide the repair, guide the healing back to normal. You don't want to mess around with this by yourself, all right? The nephrologist can work with your doctor and you to help figure out what the cause of the kidney damage is and come up with a plan to help your kidney function recover, all right, and get it back into working shape. That's really important for the filtering function, as I told you, to get blood volume, protein, kidney hormones that regulate blood pressure, electrolytes that allow your cells to function. When your kidneys fail, it is sort of like a very likely, like dominoes. If your kidneys fail, other organs can start to fail too. So you don't want to go there. All right. Now it is true. Sometimes kidney damage is so severe you can't really help the kidney recover very well, or maybe it recovers very, very slowly. So as doctors, we're actually able to give you artificial filtration. All right. And that's called dialysis. Probably heard about that term before. Dialysis is really when we, as doctors, help you, the patient, with compromised filters, like your left kidney, right kidney is not working well. Why don't we, hopefully temporarily, divert the blood out and have an artificial filter in a doctor's office or in a medical center, or we can eventually kind of do a certain kind of dialysis in your home, filter the blood for you while your kidneys repair themselves, all right? That's a big deal. If you're actually into the dialysis, your kidney damage has gone to a really, really advanced stage, and everything that needs to be done should be done and allowed to help your kidney recover from the damage. Now, if the kidney can't recover from that damage, well, you might need to take it all the way down to the end of the line, and that's where we do a kidney transplant. All right. Kidney transplant was once a totally audacious thing to do, is to take a kidney from another person, a donor, and put it into you. But listen, if you need a filter replaced and your own filter can't be fixed, that might just be the thing to do. All right. Now, I mean, this is now a pretty standard organ transplant procedure. The medical system has had lots of experience with it. It actually works pretty well, but obviously you want to do everything you can to avoid getting a kidney transplant. So you see, kidneys, very important. Kidney problems can sneak up on you. If they sneak up on you, by the time you see them, you're going to get a doctor involved, and the doctor's going to take very, very specific steps to try to figure out what's causing the problem, how to actually help your kidneys heal themselves up, even if you need to actually have some artificial filtration for a short period of time, or if you can't salvage it, we go down to kidney transplant. All right. That's the entire gamut of thinking. All right. And the key thing is that you need this filter every single day of your life. Now, let's revisit, how do you actually use food and diet, all right, in order to be able to actually help to tackle kidney problems. So I told you the medical side of things. It's pretty serious, right? Pretty significant. But there are things that you can do with diet that can actually be important, right? So these are the things you're like the dialysis and the scans that happens at the medical center or your doctor's office. But the things that you do at home, your diet, are things that the kind of healthcare that you do for yourself. And here are some important things. Now, the one thing I told you could do is you could actually keep your salt down, all right? Keep your sodium intake low, all right? That's the number one thing. And that means avoiding high salt foods, right? So why is that important? What does salt have to do with your kidneys? Well, excess salt puts more stress on your kidneys because the salt in your bloodstream increases the blood pressure, and the high blood pressure forces more blood down into the filters, making the filtration have to work harder. You're filtering at a higher rate. The kidneys have to work harder. If you're already having a kidney problem, you don't want to actually have to push it to the limit. All right. So I think about, in terms of like the force of blood filtration that has to be done. Think about, like the kitchen sink, turning it on low, and you got a little dribble of water out versus a fire hose. You turn that baby on and you get this huge jet of water. So high salt, high sodium, all right, can make kidney failure worse, and you don't want to do that. So don't eat too much salt. Now, when it comes to foods, there are some foods that you actually have to be careful, very careful about as well, because they can be very high in sodium or salt. What are some examples of that? Ultra processed foods tend to be very high in salt. In fact, if you look at the ingredient label on the back of a package of ultra processed foods or a can, like a soup can, check it out. See where salt or sodium is on the ingredient label. The sooner it comes up in the ingredient label, like if it's the first 10, it's pretty high in terms of the concentrations that are in that product. So ultra processed foods like pre-made soups, the ones that you probably grew up eating like I did, snacks, chips, potato chips, salted tortillas, all that kind of stuff. Listen, when they say they add a little salt, they're adding quite a lot of salt. Salt tastes good. Salt sells products. Our body craves salt. All right. So that's why we like, having a little salt on things. And pre-made meals, the kind that you pull out of the freezer and you pop in the microwave. Shouldn't be microwaving anyway, but there's plenty of frozen dinners and frozen meals you can pull out. Those tend to have a lot of sodium as well. Why? Because they taste good, all right? And salt is also kind of a preservative as well. Pre-made seasonings, by the way, you want to get like a barbecue rub. Those things tend to have a lot of salt added to them. Salt tastes great. That's why people that make foods that are supposed to taste good, they don't have a problem adding salt. But if you have kidney problems, you need to be very, very careful for the reasons that I told you earlier. A lot of salt actually puts your kidney that's already under stress, under more stress, and you don't want to be able to do, you want to do that at all. All right. Now, there's another kind of food type that's a kind of a danger area when it comes to salt. And you know what that is? Restaurant food. In a restaurant, all chefs know this, salt tastes good. So if you've ever been watching a chef at work, like if you go to one of those restaurants where they have an open kitchen and you sit to be able to face the open kitchen and watch it, check out the people that are salting the food, all right, or finishing the food, or preparing, they're just about to put it on the griddle or put it on the stove. You'll see they're actually sprinkling salt in there. I bet in some of the restaurants you might go to, they are just throwing kind of a cloud of salt right onto your food, and then they put it on a griddle or a grill or a pan because salt tastes good, all right? Restaurant food is known to be high sodium, which is why in a lot of restaurants, starting in the 1980s or so, restaurant menus started to list low sodium foods, but it doesn't matter. Any restaurant you go to can have a lot of salt in their food. What you need to do, if you've got kidney failure or problem with your kidney, you should tell the wait staff, whoever's helping you, that you need to actually have a low sodium version. All right, and they should be able to tell the chef to go easy or like avoid the salt at all. All right, that's a very important thing to do. Again, remember, a lot of salt, a lot of blood flow, a lot of stress on the kidney. So if you've got kidney failure, go low on your sodium. That's number one. Number two, you want to avoid eating too much red meat. if you actually have kidney failure or a kidney problem. All right. Now, you already know, I mean, pretty much everyone knows these days that eating a lot of red meat, not good for you. All right. It's not good for your health. You should actually eat mostly more of whole plant-based foods and, cut down your meat to a small amount, or if at all, cut down or cut out your red meat. All right. And I know some people talk about the carnivore diet and what the benefits are for those. But listen, right now for this video, we're talking about people with kidney failure. So we're not talking about, a health trend. We're really talking about somebody who's got kidney failure and what should you do? Cut down or cut out your red meat. All right. Eat more plant-based foods. The plant-based foods, of course, will have more polyphenols, more dietary fiber, and actually, even though red meat is an obvious source of protein, it turns out a lot of plant-based foods are also a great source of protein as well, just plant-based protein. So you can actually get what you need. This is why, vegans actually are totally healthy, right? If they're getting their protein from plant-based sources. So back to the red meat. If you've got kidney damage, getting your protein from red meat can tax your kidney even more. Now, we don't understand the full nature of this, but I can tell you red meat, a diet heavy in red meat, okay, can generate toxins like uric acid, TMAOs. This is trimethylamine and oxide, TMAO. All of these toxins from meat need to be filtered out through your kidney, right? So your kidney is filtering everything out of your blood. And so if you already have a compromised kidney and you're filtering more toxins that are generated from eating red meat, the uric acid, the TMAOs, now you've actually taken a weakened kidney and you've punched it even further. It's even going to have a harder time kind of trying to heal itself. So red meat is not healthy for lots of reasons, but you don't want the toxins that can be generated, the kidney toxins that can be generated from red meat to be able to damage your kidney more if you actually already have kidney damage. All right, that can make the situation a lot worse. And this is, by the way, another reason to switch to a plant-based diet if you have kidney disease. And by the way, if you're going to be on a plant-based diet, you want to be careful about which fruits and vegetables that you're eating as well, because some of them are high in certain minerals that you got to be careful about as well. And the reason is because, remember I told you, the kidney is a filter, helps to balance the electrolytes in your blood, right? Like sodium, potassium, phosphorus, magnesium, right? Now, some foods might have a lot of phosphorus. And phosphorus is one of those elements, the minerals, that is really important. The kidney actually normally eliminates phosphorus. It's a mineral, all right, in order to be able to regulate how much phosphorus is in your blood. And that is actually important because phosphorus actually does something with calcium. I'm going to talk about that in a second, all right? So when you have kidney damage, it can be difficult, more difficult for the kidney to release the phosphorus, to get rid of the phosphorus so you have the right amount. And so what winds up happening is that phosphorus levels build up in your bloodstream. They should be down, but phosphorus levels can build up with kidney problems, okay, kidney failure, kidney disease. And in fact, about 70% of people with kidney disease have hyperphosphatemia, high levels of phosphate in the body, in the blood, all right? Now, why is this a problem? Well, phosphate actually binds to another mineral called calcium, all right? And phosphate binds to the calcium and pulls it out of the blood. And so if you have a lot of phosphate in your blood, it'll bind to calcium that should be in your blood as well, but it'll pull it out of the blood and it'll actually cause mineral deposits in your body. All right, so too much phosphorus leaches out calcium from your bloodstream and it can deposit it in your blood vessels. Now, where does that calcium come from? Where does that phosphorus start leaching the calcium from? Pulls it out of your bones. All right, and that's not what you want. You don't want excess calcium to be pulling calcium out of your bones. You need that calcium to have good, strong bones, especially as you age, especially if you're a woman, especially if you're an Asian woman. These are all things that you need to watch out for. You've heard about osteoporosis, right? You don't want actually kidney failure to be able to cause you to have high phosphate levels. High phosphate levels start pulling calcium out of your bones and then crystallizing in your blood vessels. That is a big problem. Now, when these mineral deposits, the calcium phosphorus deposits accumulate in your blood vessels, that can actually set you up for a heart attack, right? Your plaques which can be soft, to suddenly become crystallized and hard. And those hard crystallized plaques can crack. It's kind of like part of a cave, a stalactite or stalagmite. Let's call it a stalactite, which is on the roof. Stalagmite grows from the bottom. Stalactite is tough, mineralized, right? It cracks, drops to the ground. That's not what you want to have in your blood vessels. That is actually a setup for a heart attack. But it actually gets even worse because calcium deposits, calcium phosphorus deposits, can also happen in your eyes, right? And I'm telling you, like this kidney problems with high phosphorus is really an issue. You deposit the calcium deposit in your eyes, that can compromise with your vision, and you don't want to be able to have that either. So, what are the foods that you want to be careful about, avoid, cut down or cut out because they're high in phosphorus, right? And so, let me list some of the foods that are high in phosphorus. Chicken and turkey are two healthy meats that are actually high in phosphorus. Pork is the other white meat actually is also pretty high in phosphorus as well. So you got to be careful. This is why I'm saying, like, cut down on your red meat for the reasons we just talked about. But chicken and turkey and pork also have high phosphorus levels. So you want to make sure that you're not really eating very much of those, if at all. Milk and cheese are also very high in phosphorus. Remember, you've got kidney damage, your kidney's having enough difficulty getting rid of phosphorus. Don't be loading more phosphorus into your system. So milk and cheese, high in phosphorus. Some seeds that are normally really healthy to have, like sunflower seeds or pumpkin seeds, and tree nuts too, especially Brazil nuts, are really, really high in phosphorus. So watch out, don't have Brazil nuts. Watch out for seeds. And it's a bummer because a lot of these things are super healthy otherwise for your body. All right. But when you've got kidney failure, you want to make sure that you are really following along and tracking to make sure that you're not damaging your kidney further, or you're not provoking, as an extension of your kidney problems like calcium deposits and calcium being pulled out of your bones. All right. High phosphorus foods put you at risk for that. Now, another source of high phosphorus foods are ultra processed foods. All right. A lot of phosphorus is found in additives that are added into packaged foods. It's especially found in, for example, the dark colored soda. And packaged baked goods also have a lot of phosphorus. Cookies and pre-made cakes, the stuff that, can sit in the shelf for weeks, right? And fast foods, by the way, chicken nuggets, for example, which are a very popular favorite food for a lot of people. Fast food also can be high in phosphorus as well. Okay, so we said you have to be careful with phosphorus in your food. We said you want to cut down on your red meat. We said you want to actually be careful of the sodium you actually have in your food as well. All right. Now here's another food you want to be careful about. You want to avoid foods that contain oxalates. So what are oxalates? Oxalates are basically naturally occurring chemicals that are crystals. And these crystals actually get filtered through the kidney. Now, in a normal, healthy kidney, oxalate crystals, not great for the kidney, but the kidney can handle it. You got a million of these filters that can handle it. But if you've got a compromised kidney damage, you got oxalates, they can actually cause inflammation right in the kidney themselves, right? And in fact, when they're being filtered, right? These are crystals passing through the filter. When the kidney's damaged, you start filtering these things, you get inflammation. On top of that, the oxalates themselves can cause kidney stones, all right? You got a kidney stone, it's one of the most painful things you can imagine, all right? I mean, people are like, remember I told you where the kidney is, right? It's in your back, either to the right or to the left of your spinal cord, your spine, just underneath the rib cage, the back of your rib cage. And imagine having a really, really sharp, relentless pain there. It is so painful, all right? And kidney stones are like that, and oxalate actually can cause kidney stones. So when your filters are damaged, it's best to avoid foods that are high in oxalates. All right, so what are some of these high oxalate foods? Again, unfortunately, some of the foods that are actually not only delicious, but also foods that are good for you. All right, so let's go through some of them. Spinach, high in oxalates. Beets, high in oxalates. Beet leaves, also high in oxalates. Swiss chard. Now, look, these are some of my favorite vegetables, and they're really good for you. The spinach and beets, they actually help your body produce nitric oxide. So if you chew spinach or you chew beets, your tongue microbiome, healthy bacteria in your tongue, interacts with the nitrogen that's naturally present in spinach and beets. Now, these are plants that actually grow close to the ground, so there's a lot of nitrogen in the soil, and your gut microbiome converts the nitrogen in spinach or beets into a form that when you swallow gets absorbed into your bloodstream as nitric oxide. And what does nitric oxide do? It causes your blood vessels to relax, your blood pressure comes down. Dilated blood vessels also help you relax. I mean, they help you overall relax as well. But it's good for blood flow. It's good for your circulation. And the nitric oxide also helps you heal by bringing in stem cells as well. So unfortunately, if you got kidney damage or kidney failure, kidney disease, you got to really stay away from these otherwise beneficial foods like spinach, beets, beet leaves, Swiss chard, one of my favorite vegetables to cook with, slightly bitter. So many great ways to actually cook with Swiss chard. Tree nuts, high in oxalates as well. Almonds is one of them I point out to you. Potatoes also can be high in oxalates. Beans, navy beans in particular, are high in oxalates. That's a bummer because beans are an important food, great source of protein, phenomenal source of dietary fiber. And actually, they're a staple food of the blue zones where people live long and live well. But if you're starting with kidney damage, you want to avoid navy beans, for example, because it can actually, it can be high in oxalate and cause kidney damage and kidney inflammation and kidney stones. One more food that is high in oxalate, unfortunately, dark chocolate. All right, I know, listen, I've taken away so many good foods in this video, but I'm just warning you that these foods contain oxalates, the ones I just talked about: spinach, beets, beet leaves, Swiss chard, almonds, potatoes, navy beans, and dark chocolate. Unfortunately, because all these foods also have dietary fiber, bioactives, that are really good for anti-inflammation, good for your stem cells. They activate your body's health defenses, like I wrote about in my first book, Eat to Beat Disease. But you got kidney damage, you got to back off this stuff to allow your kidney to heal, because you don't want inflammation to be happening in your kidney. All right, now these cause kidney inflammation in the setting of kidney damage, right? So if you have normal kidneys, you don't have to worry about it. The filter's working just fine. It'll regulate. If your kidney's already compromised, having these oxalates, a lot of foods with oxalates can actually make it a lot worse. All right. So dark chocolate, as I mentioned to you, navy beans, you got to cut those down, cut those out. All right. Again, these are normally foods that are beneficial for your health, but if you've got kidney damage, you got to watch out for it. If you don't have kidney damage, you're fine eating these really great foods, good, delicious foods, good for your health. All right. Now, here's another food that you actually want to be super careful of if you have kidney damage. And these are foods that are high in potassium. All right. Again, potassium is one of those elements that your kidney filter actually deals with. It filters it so you can make sure that you have just the right amount in your bloodstream. Now, potassium is actually really important. Okay, you need potassium in order to be able to help your heart pump. Okay, the electrical system of your heart pumping in just the right way. Potassium is key. You don't have enough potassium, you're hypokalemic, is not having enough potassium. Your heart rhythm can actually go crazy, but so can it go crazy if you have too much potassium as well. Hyperkalemia is super dangerous to actually have because it can actually disrupt your heart rhythm. In fact, you can go into ventricular fibrillation if you actually have too much potassium in your blood. That is something that could be a cardiac emergency. All right. So foods that are high in potassium, which our kidney normally filters to get the right amount. If you've got kidney damage, it might not be able to actually manage the right amount of potassium. So you got to be careful about eating the foods that naturally contain high amounts of potassium. All right. So you're saying, all right, Dr. Lee, tell me what are the foods that are high in potassium? Are you ready? Okay. I'm just going to warn you ahead of time. These are some of the foods that are normally quite good for your health. Avocados, normally great source of dietary fiber. All right, bummer, high in potassium. Bananas, you probably heard about bananas as a source of potassium. It's true. You got to be careful with those bananas. Dried fruits can be high in potassium because it takes the whole fruit that will have some potassium and it concentrates it down into a tiny little bit. And you can eat a lot of fruits that way. A lot of potassium from fruit, when it's dried down, concentrates it, and then you're just basically swallowing potassium pills in the form of dried fruit. Not good if you've got kidney damage. Potatoes, including sweet potatoes, can have a lot of potassium. Tomatoes, unfortunately, one of my favorites. Tomatoes can also have a lot of potassium. And citrus, like orange juice. Eating an orange might be okay, but orange juice, you drink a glass of orange juice, a tall glass of orange juice takes 8 oranges in order to make a tall glass of orange juice. And that means that if you drank a glass of orange juice, you'd be having the potassium found in 8 whole oranges. You're probably not going to be eating 8 whole oranges at one sitting. When you drink a tall glass of juice, which I could do at breakfast, for example, I could just gulp that down in less than a minute. All right. That's actually a lot of potassium load. So again, remember, your kidney filters the potassium to make sure the right amount is in your body. Potassium is important for lots of things, your cells to function, but especially your heart's electrical system. Not enough potassium, dangerous. Too much potassium, even more dangerous. It can actually trigger off a fatal heart rhythm, all right, ventricular fibrillation. So you basically need to be careful about how much potassium you have if you've got kidney damage, all right? Now, actually, let me just tell you, since we're talking about potassium, what are some of the signs of not having enough potassium? Because don't forget, your kidney's having problems regulating the potassium. If you have too little potassium, hypokalemia, that can cause an abnormal heart rhythm, I told you. It can cause low blood pressure. It can cause, and if you have low blood pressure, it can cause you to be lightheaded. It can cause numbness and tingling because your nerves depend on potassium. It can cause your muscles to twitch. All right, your muscles actually need a right amount of potassium. You can also have muscle cramps, by the way, if you've got too little potassium. And because it affects your muscles, if you don't have enough potassium for your muscles, it can cause weakness. And I'm not talking a little weak. I'm talking about extreme weakness. All right. And it turns out that when you have low potassium, hypokalemia, tend to get constipated as well. All right. So lots of things that can happen if your kidneys are damaged. You got to watch out for with potassium, which is why if you've got kidney damage, your doctor is going to be checking those electrolytes on a blood test to make sure things are looking like they're doing okay. You're still in a safe zone. Now, what about hyperkalemia? Too much potassium. I told you that's also dangerous. What are some of the symptoms there? Well, palpitations, fluttering of the heart, all right, like really sort of dangerous rhythms that can emerge, shortness of breath, chest pain, nausea, vomiting. These are all the signs of a potentially life-threatening situation. Hyperkalemia is very, very dangerous, all right? And if you're hyperkalemic, you won't even know about it except for these symptoms when you're at home. You go to the hospital, in the emergency room, they'll draw blood on you. They'll figure it out really lickety-split. They'll figure it out real quick, all right?
Hey there, if you're ready to take control of your health using the power of food, then I encourage you to check out my Eat to Beat Disease online course. More than 4,000 people from 80 countries have taken it, and now they know how to eat to beat disease. And you can too. I personally developed all the material in this course, drawing from my latest research and my years of experience. It's designed to give you practical, science-based strategies that you can use to boost your health every single day. To learn more, click the link below.
So we talked about some like being very careful and trying to avoid foods that are actually high in potassium. Bananas, avocados, sweet potato, spinach, watermelon, high in potassium. White beans, by the way, white beans, serving of white beans has twice as much potassium than a banana. All right. So, it's one of those foods that you want to be careful about. I want to say this again. A lot of these foods that you want to cut down or cut out, avoid if you've got kidney damage, it's just temporary. All right. It's temporary because you want your kidney not to get stressed out more. You want to take a bad situation to make it worse. You got to let the kidney heal. So you want to stay away from these types of foods. These foods otherwise are incredibly beneficial to your health. They've got polyphenol, dietary fiber. Actually, they're good for the rest of your health. So, but you need to let your kidneys repair themselves. All right. Very, very important. Concept in food as medicine is that there's a right time and a right place for different types of foods. Kidney damage, because of how important the filter is, this is nothing you want to monkey around with. And so you just need to take a break from some of these foods. The foods with high potassium, high oxalates, high phosphorus, high sodium. These are, it's really for your own well-being. Let your kidney repair itself. Then you can kind of get back to the usual business of living your life carefully. All right. So this is an issue. Kidney disease, kidney damage, kidney failure is really, really serious. You want to find a way to avoid all those potential downstream problems like dialysis and transplant, if at all possible. Let your body heal itself first. Now, I want to spend a little bit more time talking about diabetes, because diabetes is the second most common cause of kidney damage, kidney disease. And in diabetes, we actually call diabetic kidney disease, we give it a name. It's called diabetic nephropathy. Nephro meaning kidney, pathy meaning disease. So diabetic nephropathy, it's a fancy word meaning kidney disease coming from diabetes. And again, it's a filtering issue. The filter starts failing. And instead of filtering your blood and keeping the protein into your blood, in diabetes, the filter just lets the protein out into the urine. All right. The protein just leaks right out of the kidney, is in your bladder with your urine, and you pee it out. And what happens is that when you pee out, when your pee contains a lot of protein, from a distance, from the toilet seat down to the water, it's some distance, protein will froth up and you'll get bubbles. Okay. And this is called proteinuria. When you've got protein in your urine that's leaking out of your kidneys, you're losing protein out of your blood. All right. What happens is that then the oncotic pressure, as we call it, in your kidneys, low protein in your blood, guess what? The blood has a problem pulling fluid in, and then the fluid comes out of your blood vessels and overloads into the tissues of your body. And this can happen everywhere, by the way. Remember I told you it can cause your ankles to swell up because of gravity. Extra fluid just kind of runs downhill down to your ankles, the cankles. You can push with your finger and put a dimple into the swollen area. All right, so it's just fluid in tissue. But a really dangerous place that this happens is when it happens in your lung. Your lung's packed with blood vessels, of course, right? Because your lung is where oxygen gets exchanged with carbon dioxide, and your blood takes that oxygen up and brings it to the rest of your body. But guess what? When there's little protein in your blood and the fluid leaks out in your lungs, the fluid actually just builds up inside the sac of your lung. It's your air chamber. You don't want to actually have water building up inside your air sacs in your lungs. Now that's called pulmonary edema. You got fluid building up in your lungs. That's not a good thing. All right. And proteinuria also increases the risk of cardiovascular disease as well. I'm telling you all of this because this is yet another reason why you want to actually get your metabolism under control. Now, I wrote about how to get your metabolism under control in my book, Eat to Beat Your Diet. If you haven't read it, this is not a diet book. It's about how to avoid being on a diet, but enjoying good health and how to get a good metabolism. Here's another reason why you want to avoid it, because you don't want diabetic nephropathy. All right. So if you think, my blood sugar is running a little high, no big deal. Eventually, you let that go, you're going to head straight down the highway to type 2 diabetes, and your kidney could well become damaged, and then all these bad things that happen can happen. So please do keep your blood sugar under control. All right. And here's some simple ways of actually doing this. All right. Number one, limit the amount of calories you eat. Don't overeat. Don't overload your fuel tanks. All right. Don't put too much carbs, sugars into your body. Quit the clean plate club. Don't feel like you have to eat everything on your plate, and never go for seconds. I read about this in Eat to Beat Your Diet and all the reasons why. So ways to control your blood sugars and control your metabolism. Don't overeat. All right. keep your calorie intake low. Number 2, don't eat a midnight snack. If you eat like late at night before you go to bed, I know it's a lot of habit that people actually have, but midnight snacks actually disrupt your metabolism, and it cuts into the window while you're sleeping that your body's burning down extra body fat. All right. So when you're eating extra food at night, not only are you loading more calories into your body, but you're cutting into that fat burning period while you're sleeping. When you're sleeping, you're not eating. That means you're fasting. So when you're sleeping, you're intermittently fasting. As you know, intermittent fasting actually can help you regulate your blood sugar better. It helps your gut microbiome. It burns down harmful body fat. But the key is you don't want to eat late at night, because you cut down into the useful time when your body is actually doing it. When you eat at midnight, your insulin levels go up because your blood sugars go up. All right, and your body won't switch into healthy fat burning mode until insulin goes back down. So what I tell people to do is eat a healthy dinner, eat a healthy amount of a healthy dinner, and then when you put your dishes away, that's it. You're done for the day. That's a symbolic gesture. When you put your dishes away, no more food until the next day. All right? And that means no midnight snacking. That's a good way to control your metabolism. By the way, if you want to actually also burn down extra body fat, which can also help you keep your blood sugars more reasonable and get you away from developing type 2 diabetes. I told you that when you're sleeping, you're fasting. And because we sleep only part of the day, we're intermittently sleeping, which means we're intermittently fasting. Oops, there we are. Intermittent fasting is when you're sleeping. If you want to extend your intermittent fasting in the morning, just try skipping breakfast a couple of times a week. Again, I write about that in my book, Eat to Beat Your Diet, right here. How to actually do intermittent fasting and how to skip a couple of meals, including breakfast a few times a week. That will actually help you with your metabolism as well. Again, eliminate ultra-processed foods. Ultra-processed foods, a big no-no if you're trying to actually right-size your metabolism. All those additives, all those chemicals can damage your gut microbiome, can actually head you right towards that path of insulin insensitivity, high glucose, building up extra body fat. You don't want to be going there, all right? So eliminate extra ultra-processed foods. In addition, for all the other reasons we talked about, the high sodium, the high potassium, high phosphorus, all that kind of stuff. And to protect yourself against diabetes, eat more dietary fiber, all right? Dietary fiber helps your gut health. When your gut is healthy, your healthy gut bacteria lowers inflammation in your body. That's really important, to stay away from metabolic syndrome and type 2 diabetes. And a good, healthy gut bacteria that's fed with dietary fiber also has more and better insulin sensitivity, so your efficiency of using glucose, metabolism is just overall better, and you get to burn extra body fat as well. Okay, now the other thing I'll tell you about trying to avoid type 2 diabetes is exercising. If you got kidney damage, you might not be running a marathon, but guess what? Just stay physically active. One of the easiest things you can do to stay physically active is just like walk 30 minutes a day after dinner. There's no excuse. Everybody can do that. It's raining. Hey, you know what? Go for a walk around your house. All right. That works as well. All right. Physical activity helps your blood flow. Physical activity is good for your lowering inflammation, improving your immune system. It's actually good for metabolism as well. All very, very important aspects of good metabolic control. All right. Finally, last thing you can do with your diet, if you've got kidney damage, is stay hydrated. Most of us don't drink enough liquid, enough water to keep ourselves hydrated. If you look at your pee in a toilet after you go to the bathroom, and it should be pretty much transparent, clear, maybe a touch of yellow. If it's like darker than that, if it looks like dark yellow, orangish, you're behind. You need to drink more liquid. Your kidneys also need to be watered to stay in good shape. So if you've got kidney disease, remember, these are filters. You need to kind of flush the filter, right? Think about it. For healing the kidney, you want to keep the kidney well flushed, well watered. If you are dehydrated because you're not thinking about drinking enough liquid, then you can actually take that kidney and dry it up, and now the filter is having an even bigger problem. You want to keep that kidney well watered. Do not get dehydrated if you've got kidney damage. And by the way, the other thing you can do when you get dehydrated with diabetes is that the nephropathy, the protein pulls out a lot of water. You can actually become relatively dehydrated just by having diabetes. All right, then you got to drink water to keep it up. So if you've got diabetic nephropathy, you've got kidney damage due to diabetes, you are probably going to find it very easy to be behind on your liquid intake. So drink more water. All right, that's something you want to pay close attention to. You need to keep your kidneys flushed with water, well hydrated, well watered, in order to allow it to heal itself. Which brings up another thing you want to avoid, which is alcohol, because alcohol can actually cause dehydration. Alcohol is also, the ethanol in alcohol is also a toxin. You do not want to put more toxins in your body. You don't want to expose your kidneys that are damaged to more toxins. Alcohol can also lead to high blood pressure. Again, itself a cause of kidney disease, but high blood pressure also big jet down your kidney, like stresses out the kidneys even more. And alcohol can cause you to become dry out, right? So you got to be really, really careful about this. Now, I know I've told you a bunch of things to eliminate. And if you look online, or if you look on social media, you'll find people talking about superfoods for kidney disease. No such thing, all right? Sure, anti-inflammatory foods, antioxidants, those are good for kidney healing, for sure. But as I've outlined in this video, you want to cut down or cut out the foods that are more of a burden on your kidney so it can heal itself. Don't put your kidney under more stress. You got to cut out some of these things that I told you about. Foods with sodium, so with potassium, foods with phosphorus, foods with oxalate. Cut back on those because you don't want to actually stretch your kidney out over more. Let the kidney recover on its own. Finally, I really need to stress this. It's absolutely critical if you've been told that you have kidney damage or your doctor says you've got kidney failure, you have got to work very closely with your own doctor, your primary doctor. Okay, don't miss an appointment. Keep them, show up for all the visits. Get your blood drawn. And with kidney disease, you want to work with a nephrologist. Nephrologist is a specialist in kidney. All right. These two medical professionals will work with you to help monitor how well your kidney is healing on its own. How well is your kidney doing? All right. And if you're heading into the danger zone, they'll be able to actually kind of throw you that safety net to tell you how to get out of that jam. All right. And don't forget, you're going to need a blood test to check on your kidney function over time because a blood test reveals how well that filter is actually working. All right. Okay, that's it. We covered a lot of stuff on the kidney. I was talking to you, giving you some insights as well as a medical doctor, a physician. I'm not giving you medical advice, but I'm just sharing with you some insights on how important it is for you to take action if you've got kidney damage. We've been told you have kidney damage, and to work closely with your doctor and the nephrologist, the kidney specialist. So I hope you learned something new from this video. Thanks very much for watching, and I will see you on the next video.
Hi there. If you enjoyed watching this video, I know you'll love the next one. Stay here and check it out, and I'll see you there.